Authorities in Zimbabwe have expressed concern over the continued increase in occupational fatalities, saying the country has so far this year recorded 70 deaths and 4,912 injuries at the workplace. The figures have been described as too high, and calls have been made for enhanced education on occupational safety for both formal and informal sectors. Nasablawe Rehabilitation Center Acting Manager Dr. Tapionya Magondo said more than 4,000 people were reported injured at work last year.
We invited specialist doctors and GP practitioners to try and foster synergies and collaborations with them. We have an accident prevention and workers' compensation scheme where we work with medical specialists and general practitioners. They are the source of our patients who come for our services when they are injured at workplaces. So one of the aims of our being here today is to explain the processes that, okay, once a patient is injured at work.
Speaking at the same session, Dr. Tinashi Mando, an orthopedic surgeon, said spinal cord injuries were rife at the workplace.
5% of patients with head injuries actually have an associated spine injury. But that figure can actually go up to 19%. So in other words, if you see someone with a head injury, probability is they also have a spine injury as well. Now we also realize that up to 15% of patients with spine injury also have another associated injury, whether in the thoracic or abdominal cavity. And we also realize that 10 to 15% of them have an injury, say in the cervical spine, plus another associated injury in the thoracic or lumbar spine. The point I just want to emphasize is the utility of the CT scan, especially what the first world has moved towards, which is the vertex to trochanter. Sometimes don't be afraid just to order it. You see a patient with a possible head injury or cervical spine injury, just do a vertex to trochanter CT. Chances are you pick up more than 95% of the comprehensive injuries that the patient had.
Now, as we continue to discuss health and safety in the workplace, we now cross over to occupational health and safety specialist Fidelis Shangirai. It's a very good evening to you, Fidelis. Thank you so much for joining us here on News Plus. Now, latest statistics from NASA show that an increase in work-related accidents. What do you think is causing this very worrying trend?
There are quite a number of reasons why workplace accidents do. Chief among them, probably it could be on negligence on the part of the employee. It could be because sometimes when you've been doing this work for the past 20 years, people tend to take it for granted that I've been working like this for 20 years. I know it all. I know all the ways. And instead of putting on your safety belt, you might just have to climb, do my work, fix it, and come down. You know that's one of the reasons why. When someone's so experienced, they've been doing this for a long time, they can take it for granted that I can just go up and come down. So it's one of the reasons. There are quite a number of reasons. Probably some people would be using a wrong tools for the work. For example, you're supposed to be using a safety belt, and then someone said, no, let's just improvise, we don't have a belt. Probably you can just use a rope or a wire or something like that. And there are quite a number. Probably someone has to just work without any, probably the business or the company cannot afford to offer such type of required requisite PPE.
So now, Fidelis, what needs to be done to eliminate mishaps at the workplaces?
The first thing that needs to be done is there's need for continuous training. This is for training. We need to be trained. What do you need to do when you are faced with a tricky situation? We say that zero harm is possible. You need to ensure that the employees are with knowledge on how to approach any situation before they work. So the first of all is training. Then the second of it, we can have the use of proper PPEs or proper workplace safety equipment. We need to use the right tool for the right job. And you know, when people talk about using the right tool for the right job, when you're supposed to be using a spanner, use a spanner, not to improvise and use a wire. When you're supposed to be using a vehicle, use a vehicle, not to improvise and use probably ladders and bricks. When you're supposed to use a jag, use a jag. Not say, I know I can just make use of stones or I can make use of rocks. So, yeah, I can basically say that we need to train is the key function, so that at least every employee understands the importance of proper use of PPE.
So now, what remedies are there or are available for an employee who might be unfortunate to be involved in a work-related accident?
The main remedy is to approach NASA. If you're hit or injured at work, there are forms that are supposed to complete that are going to be submitted to NASA. If we're injured while it's on duty, you're supposed that complete of the form and then submit to NASA for compensation. There should be in terms of the work Factors and Works Act. Any person who's hurt or injured during the workplace should be able to be compensated along those lines. So the remedy just to be for medical attention and other financial rewards or financial assistance. The employer has to apply, is to submit your forms to NASA for the compensation. I think basically in general that's the remedy that you have to take. That's why it's one of the key functions of NASA, National Social Security, to ensure that those who are injured during the work or during the execution of their work, they get the compensation along the way.
Konapo, ipapo pa ZTN Prime, DSTV channel 294, the place to be.